Hello, my name is Debbie Komisak. I'm going to give this video presentation on the submission for evaluating a quantitative research study. I enjoyed actually reading the article and evaluating it and researching the article. As I read the article, the impact of a brief lifestyle intervention delivered by generalist community nurses. I found the article easy to read and interesting and informative. I evaluated the study according to the research design methods from the book Nursing Research Reading, Using and Creating Evidence, written by Hauser. Beginning my research, it stated with evaluating the credibility of the research articles. As for the authors, the article of the article, I could not find any of their credentials listed within the article. There was an asterisk next to the author Mark F. Harris, indicating that he worked at the Center for Primary Health Care and Equity School of Public Health and Community Medicine University in New South Wales, Sydney. It didn't say what his credentials were, at least I couldn't find them. The article does state that his authors contributed to the study design and reviewed and approved the final manuscript. The article clearly declares that the authors have no competing interest in the conduct of this study. I found no evidence that this article was peer-reviewed. The pages were sequentially numbered, however, I found no volume and number. I could not find the article has an external editorial board or review date. There wasn't evidence of financial gains or losses presented in the article. The study was done in a reasonable interval time frame in that it was received in September 12th of 2012 and accepted April 16th, 2013 and published April 22nd, 2013. Going onward, I evaluated the problem statement and research design from the article. Development of the problem statement. First, the article did narrow from the general to specific in that it started with all the problems of the community in general to narrowing down the participants after intervention, and the statistics were clearly revealed. The purpose is inferred in that it was conducted to conclude if any early intervention group or a late intervention group both provided with interventions to achieve and maintain lifestyles changes differed. So it evaluated both those groups, and it came to the conclusion of the early intervention or the late intervention being a better outcome for the community. The statement or inference is clearly outlined in the abstract block in the method section. It is outlined early and it is easy to find in this article. The concern is clear in that it stated the concern for people with risk factors for chronic diseases and of community health nurses, which are an important component of the primary health care in Australia, could make a difference in decreasing these risk factors. I feel the research develops and expands nursing knowledge in that it showed how there needs to be ongoing and continuing education, long-term and short-term interventions. It needs to ongoing long-term because short-term interventions do not reach the desired goals. The article did expand on the research on the effectiveness of brief lifestyle interventions done by family practice services. It found that the community health clients did not benefit as much as primary health care setting patients. I feel the article improves patient care for the underprivileged who use community health care nurses, in that it concludes that longer-term interventions must be provided. The ethical issues were next evaluated. There was no potential harm to the participants in this study. I could not find approval for IRP. It is clearly stated that the subjects gave their informed consent, stating that, quote, all participants provided full informed written consent for publication of findings from this research, end quote. The project was approved by the Hunter New England Human Research Ethics Committee. It was conducted in compliance with this committee regulation and the Helsinki Declaration. The research was conducted with anonymity. There was no evidence of coercion to motivate the subjects to participate in the study. There was disclosure provided to the participants. I feel the benefits outweighed the risks, in that as a participant, the subjects received teaching and intervention to improve their lifestyles, to impact their health in a positive way. The participants were recruited by meeting a selection criteria. They were contacted by phone by an authorized recruitment officer. I went on to evaluate the purpose statement of this article, and using the evaluation checklist from the required textbook, I found the article narrowed from general to specific as in the problem statement. The purpose is to increase the health benefits of the people receiving community health nursing. The statement is provided early in the article, easy to find in the abstract box. I feel there is unbiased verb would be the participants' readiness to change their risky behaviors. The article clearly described the design and setting, attributing to an early intervention group and a late intervention group. The variables were described as subjects who need to, quote, stop smoking, reduce alcohol consumption, improve weight and diet and physical activity, end quote. The population is defined in the table 1 as they are aged 30 years to 80-year-olds. They were referred to community nursing services. The setting was in the subjects' homes over the telephone survey of the outcomes. The feasibility of the studies were accessible, as all subjects needed to be able to read and understand English and be able to participate in a telephone survey. Ethical issues were addressed. There is evidence of a proper alignment between purpose and design. As to the intervention to improve health and breaking subjects into 2 groups, the early and late intervention, to observe which group has more beneficial outcomes. Evaluating literature review. I could not find that the article relied on studies conducted in the last 5 years. It only mentioned that a study was done by a family practice in which the nurses were involved in patient care. The article states its research of community health nurses to primary health nurses are found with negative findings. They state that the primary health patients do better than the community health nurse patients. I couldn't find major studies being included in this article. I couldn't find where the review was linked to a research question. There was a conceptual framework in that the risk factors were evaluated at baseline 3 months, and again at 6 months. The review provides importance of the study in that the number explains the health benefits a community nurse can intervene with for at-risk patients. The authors used primary sources in their studies by surveying the participants. The studies were reported objectively by using tables and percentage outcomes. The review is unbiased as the author states the findings on the respective table, charts, but also alludes to the possible inconsistencies such as participants not being truthful. Like for example, when they were surveyed from baseline to 3 months to 6 months, maybe when they got that telephone call, the participants could have been not telling the truth of their weight loss, for example, and so there could be some bias in the results. I could not appreciate the author's opinion was in the article. The review is organized to support the need for research to improve health for the community nurse patients. The article provided a conclusion for the important knowledge of the topic, that being that community healthcare patients need long-term interventions. They need more than is presently being provided to them to make a positive impact on their health. In evaluating the sampling strategy, the target population is clearly and objectively identified as a total of 804 patients recruited from 2,361 potentially eligible patients. The inclusion criteria was specific as to the patients that can participate in this survey, and they had to be referred to community nursing services. They had to be between the ages of 30 and 80. They needed to be able to read and understand English. The exclusion criteria was clearly identified as palliative care patients would be excluded, clients receiving only one care visit, or clients with inability to complete a phone survey would be excluded. Also, anyone receiving help in changing their lifestyle or attending formal education in health classes, they were to be excluded. The procedure of contacting potential participants by phone was identified. I feel the samples are likely to produce representation of this for the study. The author does state there may be some bias as from the participants not truthful on the telephone survey. Again, I feel the sample is of adequate size. I couldn't find where power analysis is conducted and reported in this article. With evaluating the measurement strategy, I found that the instruments used, which are tables, are clearly linked to the research topic. The tables are described objectively. The reliability is described in that there are a number of limitations since the collected data was self-report and bias could have been reported. The validity of instrumentation is described with percentages of statistics and findings. I could not find where a detailed protocol was used for each instrument. Evaluating how the study results may be used to inform evidence-based practice. I feel the quantitative nature is made clear early in the article, and a specific design is identified by using the early and late intervention groups. Rationale is to see if early or late intervention client population has any difference in the outcomes of the client's health. The procedure is described for the application of intervention and treatment, in that the community health nurse is to intervene for the subjects of the study to provide education to increase health outcomes. There are tables used to support the statistics and the findings. I could not find a detailed protocol for the use of each instrument. Threats to internal validity are addressed that there may be bias since the study survey was self-report. I couldn't find where there was a blinding stated in the research. I feel the authors provided valuable information in that the longer-term intervention needs to be provided to these community health patients to improve their health. They need longer-term education and follow-through than the 3 to 6 months so that significant changes can be made to their health and the patients decrease their risky benefits by getting this longer-term interventions by their community nurse or where they live. That's all. Thank you.